There have been multiple trials that have evaluated Dabrafenib with or without Trametinib for the treatment of BRAF V600E mutant non-small cell lung cancer. The initial trial just used Dabrafenib. And they said, okay, well, we see a response rate of around 30%. And what they found was that there was exactly the side effects you'd expect with Dabrafenib. So one of the key concerns about Dabrafenib monotherapy and any BRAF targeting monotherapy is the development of keratoacanthomas on the skin, which can then develop into squamous cell carcinomas. We know by extrapolating data from melanoma that when we combine that with a MEK inhibitor such as Trametinib, we can enhance the response rate and decrease the incidence of these cutaneous toxicities. And so there were two trials done, which combined Dabrafenib and Trametinib. And one trial, they used it in the first line, and in another trial, they combined Dabrafenib and Trametinib after other prior treatments. Now here's a source of, it's pretty reassuring. The response rate and the overall outcomes in these trials was nearly identical. And so we can give Dabrafenib and Trametinib in later lines and expect just as good outcomes. My concern, though, is that if I have a patient in front of me, I like to use my best treatment first. And in my mind, there is no doubt that the targeted therapy is going to have a higher response rate than would be seen with chemotherapy or chemoimmunotherapy. The combination of Dabrafenib and Trametinib is associated with a response rate of around 60%, and that is superior to what we would expect to see with chemotherapy, immunotherapy, or chemoimmunotherapy here. This patient had a response that lasted for at least 9 months, and that's what we tend to see with the use of these agents. You'll see a response that lasts anywhere from 9 months to a year, and then you can have progression. Dabrafenib and Trametinib are generally pretty well tolerated. The one main side effect which we tend to think about with this combination is fever. And the fevers happen early, and they do happen pretty often. It's important to counsel the patient about how to manage them using Tylenol to reduce the fever, and to reassure the patient that this is not an indication that the treatment is not working, or that the cancer is growing, or that they have an infection. But that is something which you have to look out for. If you have a patient who's been on Dabrafenib, Trametinib without fevers, and then all of a sudden develops fevers, you should still look for signs of infection in that setting. Usually the fevers happen early. In terms of nausea and vomiting, there are dose reductions which can be used, but really the big one which I look out for is fever and sometimes fatigue.